Today, let's talk about something almost everyone has experienced. Headaches. They can be annoying, but sometimes they're a sign of something more serious.
Absolutely. I think people often wonder, when is a headache just a headache and when should you actually worry?
That's the big question. Most headaches are harmless, like tension headaches or the occasional migraine. But there are red flags we shouldn't ignore.
Right, like a sudden severe headache that feels like the worst pain you've ever had. That could be a sign of something urgent, like a brain aneurysm.
Exactly. And if a headache comes on after a head injury, or if it's accompanied by loss of consciousness or confusion, you should seek help immediately.
I've heard that headaches with vision changes or weakness on one side of the body can also be pretty serious.
Yes, those could suggest a stroke or other neurological issues. It's always better to be safe and get checked out if you notice those symptoms.
What about headaches that keep coming back? Is frequency ever a reason for concern?
Chronic headaches are definitely worth discussing with the doctor. Sometimes, frequent headaches point to underlying issues, like medication overuse or other health problems.
Speaking of medications, isn't it ironic that taking too many painkillers can actually make headaches worse?
It's a weird twist, isn't it? Overusing over-the-counter pain medicine can lead to rebound headaches, which just keeps the cycle going.
So moderation is key. But besides medication, are there lifestyle factors that contribute to headaches?
For sure, stress is a big one. Lack of sleep, dehydration, skipping meals, these can all trigger headaches for some people.
I'm guilty of the dehydration one, especially in summer. Sometimes I forget that a simple glass of water can do wonders.
Same here. And let's not forget posture. Sitting hunched over a computer for hours can really tighten up those neck muscles and trigger a headache.
It's funny how the modern lifestyle seems designed to give us headaches. But what about migraines? How can someone tell if their headache is a migraine?
Migraines often come with other symptoms, like nausea, sensitivity to light or sound, and sometimes visual disturbances, called auras.
I've heard some people get warning signs before a migraine, like seeing flashing lights or zigzag patterns. That must be unnerving.
Definitely. Those auras can be scary if you don't know what's happening. But not all migraines have auras, which can make them harder to identify.
Are there specific triggers for migraines?
Yes, but they really vary. For some, it's certain foods like chocolate or red wine. For others, it could be hormonal changes, stress, or even weather changes.
Weather changes? That's a tough one to avoid.
No kidding. You can't exactly negotiate with the weather, but keeping a headache diary can help people spot patterns and avoid triggers when possible.
That sounds helpful. Writing down when headaches happen, what you ate, and what you were doing can reveal surprising connections.
Absolutely. Sometimes, just noticing the patterns is the first step toward managing headaches better.
So when should someone actually see a doctor about a headache?
If it's sudden and severe, if you have neurological symptoms, or if headaches are happening more often or getting worse, it's time to see a doctor.
And for headaches that wake you up from sleep or get worse when you cough or change position, those are warning signs too, right?
Yes, those can indicate increased pressure in the brain, which needs medical attention.
It's a little scary, but most headaches are still harmless, right?
Definitely. The vast majority are nothing to worry about, but knowing the warning signs can really make a difference.
And if you're not sure, it's always better to ask a professional than to Google your symptoms and panic.
Couldn't agree more. The internet can be a scary place when you have a headache.
So what are some good ways to prevent everyday headaches?
Staying hydrated, getting regular sleep, managing stress, and maintaining a healthy posture are all great starting points.
And maybe taking breaks from screens, going for a walk, or just closing your eyes for a few minutes can help too.
Little changes can make a big difference. And if you do get a headache, sometimes a cool compress or a quiet dark room helps.
I love the classic put a cold pack on your forehead trick. It's old school, but it works.
Sometimes the simplest remedies are the best.
Are there any myths about headaches you've heard that just aren't true?
Oh, plenty. Like the idea that all headaches are caused by eye problems. While eye strain can trigger headaches, it's not always the culprit.
Or that caffeine always makes headaches worse. For some people, a little caffeine can actually help, especially with migraines.
Exactly. But overdoing caffeine can backfire, so it's all about balance.
It seems like understanding your own body is key. There's no one-size-fits-all answer.
That's true. What works for one person might not work for another, so trial and error is often part of the process.
Before we wrap up, any final tips for listeners dealing with headaches?
Don't ignore warning signs, but don't panic over every ache either. Keep track of your symptoms and talk to your doctor if you're concerned.
And remember, most headaches are just a part of life. With the right strategies, you can manage them and get back to what you love.
Absolutely. Take care of yourself, and don't let headaches hold you back.
Thanks for joining us today. If you have questions or stories about headaches, we'd love to hear them.
And remember, sometimes a headache just means you need a glass of water and a break.
Or maybe just a good laugh. See you next time.